Justin Minion is in Irvine, California, with a question. Justin?
Hi, Anderson. Hi, Sanjay. Thanks for having me. Tonight, I had a question regarding face masks. I've heard two different sides of this story. One, that these masks are ineffective, and the other, that doctors and nurses across the country are in desperate need of these very same face masks. Specifically in regards to the N95 respirators, are these masks effective in preventing the virus? And for Americans across the country who now have these masks, what can they do and where do we go from here?
Great question.
Well, we don't recommend for everyday people, non-healthcare workers, to get masks because we do have a limited supply of these masks and we need for healthcare workers who are treating patients to have them. And surgical masks, what people normally wear, they protect other people from you if you're sick because you're coughing and sneezing into the mask, but they don't protect you necessarily from having the infection. And so my strong advice to people is do not hoard surgical masks. Do not hoard N95 masks because that's what also, doctors need.
I've been told that if you have a mask, I mean, the few times I've worn a mask, not in this case, I wouldn't wear a mask, but for stories, you end up adjusting it all the time. You end up touching your face. You adjust your glasses because your glasses sometimes fog up if it doesn't fit right.
Yeah, and look, if the mask becomes contaminated and you're touching it and then touching your face, or even in the process of taking off the mask, it sounds counterintuitive, but there's been studies on this that your risk of actually becoming infected counterintuitively goes up when you're wearing one of these masks. He makes a good point, I think. There's different masks. There's the surgical mask and there's the N95 mask. Surgical mask we're seeing on some of these images here. You can sort of tell by looking at that mask. It's not going to stop viral particles from going around the outside or underneath the mask. The N95 mask is a fitted mask. It has to actually be fit tested when you put it on. It's a tough, I don't know if you've ever worn one, but it's a tough mask to wear. Like you'd have a hard time walking a block. It's not the kind of mask that you can just wear in your daily life. We wear it in the hospital if we're working with patients that are known to have these infections. These are different masks. The surgical mask that people are wearing, the healthy people, it's not really, I think, providing the benefit that they hope for.
I'm also sick of seeing celebrities with their masks on private planes, Instagramming photos of themselves. Like, you know what, either if you have the virus, fine. You don't need to Instagram and like show off your mask to people. It's kind of obnoxious. We're all in this together.